Welcome to the NHSN Reporting How Do I Do That conference call. My name is Cynthia, and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Please note that this conference is being recorded. I will now turn the call over to Teresa Mandela. Teresa, you may begin.
Thank you, Cynthia. Thank you, everyone, for joining us. I know there was some difficulty getting in today, sort of like enrolling in the NHSN. You're probably already a little bit used to technical difficulties. But thank you again, and I am Teresa Mandela. My title is Improvement Consultant with HQI, and with me today are Linda Harris, Improvement Consultant, Jill McLean, the Program Director, and Sandy Mathick, our NHSN Coordinator here at HQI. Today's session will be recorded, and you will be emailed instructions on how to access the audio recording from our online community. During our presentation, if you would like to share any thoughts or questions, please use the chat box located to the right of the screen. At the end of the presentation, we will open the phone lines for a question and answer period. At the conclusion of the webinar, we will also post evaluation questions. Today, next slide, thank you, we are joined by two guest experts from Health Quality Innovators. Deb Smith from Virginia is an outstanding infection preventionist who has done very detailed work with hospitals in their healthcare-associated infection journey, including NHSN Reporting. And Katie Richards hails from Maryland, where she worked at the Maryland Department of Health and Mental Hygiene Healthcare-Associated Infection Program, and she was the HAI Program Coordinator and Epidemiologist. Next slide, please. We are now Health Quality Innovators, or HQI, making a measurable difference in individual and community health. You may remember us as VHQC, but now as HQI, we have a name that underscores our mission, Health Quality Innovators. In addition to being a quality improvement organization in Maryland and Virginia, HQI now improves healthcare for people in a total of 7 states, plus the District of Columbia. Quality improvement organizations like us, or QIOs, work with providers like you to achieve better care, healthier residents, and smarter spending of healthcare dollars. Next slide, please. Today we're going to help you reinforce some of the steps you've taken in your NHSN journey. Deb is going to review frequently asked questions about the NHSN process, and then we'll also review case scenarios to help strengthen understanding. Lastly, we would like you to ask your burning hot questions regarding the C. diff prevention initiative as it relates to the NHSN component. Next slide, please. So where are you in your NHSN registration and enrollment process? Have you gone to your notary to have the forms verified and scanned them over to the CDC? If you scanned your notarized forms to the CDC more than 3 weeks ago and you still haven't received your SAMS card, you need to contact Sandy Mathick immediately. Her email address is on the bottom of the screen at sandy.mathick@hqi.solution. For the rest on the call, have you received your SAMS card? Have you submitted your contact and survey form to get enrolled? Did you sign all the forms and get final notice of successful enrollment? Have you joined the required NHSN groups and mapped your facility? Have you added your new users? Remember, the participation agreement attesting that the infection prevention team leader in your building will actively participate in this initiative has been uploaded to CMS. This means your facility has committed to register, enroll, and report into the CDC's NHSN system. Every week, Medicare sends us a list of which facilities have enrolled and which have not. You do not want to be on the have not enrolled list for Medicare. Please reach out again to Sandy Mathick for assistance with any step in the process. Next slide, please. Well, the deadline for all long-term care facilities to be enrolled and ready to report in the NHSN system was October 31st. Unfortunately, CMS recognized that the CDC was overwhelmed with requests for SAM cards and other pieces of the enrollment process, so next slide please, they gave us a small grace period. The goal from HQI is to have most facilities enrolled by Thanksgiving. A few of you were not participating in the initiative early on, but for those of you whose building signed up back in June or July, if you are not yet fully enrolled and need any assistance, please reach out to us right away. Next slide, please. Now, we have not dropped you out of the helicopter all alone in a field like Survivor to get through the NHSN process. There's a helpful binder and a true step-by-step NHSN enrollment setup and data guide, which was emailed to all of you back in early October. Sandy Napick sent you an email with the guide as an attachment in addition to the big 3-ring binder. Please open the emailed guide, use it, and save it to your desktop. If you have any trouble locating either your NHSN guide that was emailed or your binder that was FedEx, let us know because, well, things happen. Just please contact us immediately and we can help you out. Without the resources, it can be difficult or almost overwhelming to get through all the steps you've committed to do. Next slide, please. Right now, I'd like to switch gears and I'll let it go wild for a minute to let you know that as of today, 16 nursing homes in Maryland and 16 nursing homes in Virginia have completed all of the steps of registration and enrollment. The 32 facilities are ready to begin reporting. We can't see you, but please stand up and take a bow. That's me clapping. All right, let's dig into today's content. This is going to start by taking us through some frequently asked questions. Today's slides were mailed to you via email in the access details. They will be posted also on the HQI online community, and you already have this information in your binders. Additionally, we'll be sending it out again following today's webinar. Yes, please take it away.
Thank you, Teresa, and good afternoon, everyone. Sorry about the little mix-up in the beginning. I wanted to start off by saying that I did meet some of the participants in this C.diff work for nursing homes at the long-term care infection prevention conferences, the education that was offered in the Eastern Shore part of Virginia, and it was really nice to talk to you. Thanks for coming up to the booth, those of you that did. So let's just jump right in here with these frequently asked questions. As Teresa said, we're trying to get ahead of the game and ask these questions, give you the answers, but this is not your last chance to ask questions. There will be plenty of time at the end if we haven't covered the questions that you'd like to know about. So let's just begin. I just can't contain my excitement about reporting my data each month. So what day of the month does the NHSN expect my reports? You don't see that in the instructions. So the answer to that is that the NHSN and HQI expect you to submit your previous month's data no later than the 25th of the current month. So that means that this November 25th, you would need to have your October data in. And the next 2 months with the holidays coming up, just pay attention to the holidays. And if you want to report earlier, we're happy to get your data earlier. So do all users need a SAMS card, or can they all use just one from the facility administrator's card? And, of course, the answer to that is that every user needs their own specific SAMS card. So you can't share these cards. They're for you only. So everyone that's going to be entering data into NHSN needs to apply for and get a SAMS card. When I'm entering the facility info in the long-term care annual survey online, can the entered data be saved and completed later? And wouldn't that be nice? But the answer to that is no. So when you are completing your long-term care annual survey, all the data needs to be put into that survey in one sitting. So So that means that a user can't enter some and come back and enter some later. The suggestion for that is to print off the paper form. There's a place in NHSN where you can print that form. Take that. Some of the questions you may have to go different places in your facility and ask different staff members so that you can get all the answers. So have everything filled in, and then when you do your survey online in NHSN, it's just a simple matter of data entry, and you can get that all done at one time. So I'm only reporting CJES Lab ID results for residents in the skilled rehab part of my nursing home, right? And that answer is no, because we're reporting facility-wide inpatient for all residents in all locations of your nursing home. So when you enter the specific Lab ID CDI event, you'll be entering the specific location where the resident was assigned at the time of specimen collection in your entire facility. Question: I completed all the forms, including my identification documents, and scanned them. Then I uploaded them to NHSN. So when will I get my card? Well, just as Linda, or as Teresa, told you in the beginning, you have to have all of this information notarized before you can send it to NHSN. So you won't get your documents until you have. NHSN won't accept them until, and if you do send them in without being notarized, they'll just have to send them back to you. You'll start all over. And the reason for this is that you're actually being granted access to a secure federal United States government health reporting system. So they have to identify everyone and have that identity verified before you can be granted access to NHSN. So my email address has changed. What do I do? And I have to admit to everybody who's on the webinar today that with our name change, HQI, our email addresses have changed, and I have not done this yet. So this will be something that I will be doing. So the answer to this is that your email address, if it's changed, will need to be changed, and it needs to be changed in SAMS first and then in NHSN. So if you would do it the opposite way, your email address, if you changed it in NHSN first, you'd get that welcome email like you did when you were first signed up, and that's not what we want. So you need to make the email change in SAMS first by going to, there's actually a web ID here, and you go in there and change your and put in your SAMS password and your credentials, select My Profile, select Home, and change your email. Now, it's going to take up to 48 hours for this change to go through SAMS. Don't make the change in NHSN until you get a confirmation email from SAMS that email has been changed. Once you get that email, you can go in and make the change in NHSN, so that'll be the second part of it. And with that, you'll go to that famous left-hand navigational bar, select User, select Find at the bottom of the screen, select your profile, go into your profile, and edit your email. The important part of this is that you'll push Save at the bottom of the screen, but make sure you actually get a little message that pops up that says it was saved successfully. So I know the annual facility survey has to be completed and transmitted to NHSN on a yearly basis. So in order to enroll the facility, you've already completed the annual survey in 2016 when you enrolled using 2015 data. So does this survey need to be completed with 2016's information before reporting in January? The answer to that is that sometime in January, before the end of the month, the new 2016 annual survey will be released, and then that'll be for January 2017. However, you will be using 2016's nursing home information to complete that annual survey. And you have to have it done before March 1st of 2017. You can still enter your data in there, but there will be no reports generated until after the annual survey is put in. So you lost your SAMS grid card, so you have to start all over. Wouldn't that be awful? Answer to that is no. If you contact the SAMS help desk, they'll be able to help you receive a new grid card. And just a little aside here, something that I've done, and maybe you've already heard of this, but I've taken a picture of my SAMS grid card. And that, of course, I never go anywhere without my phone, and my phone has a lock on it, so there's a passcode to get into my phone. But my SAMS card is always available to me on my phone. My actual SAMS card is kept in a very safe place at home, so that I don't lose it. And if something does happen, I always have access to it. So you may want to think about doing that. When I use my SAMS grid card to log in, the left-hand blue bar shows I have several alerts. They don't bother me, and I'm thinking they'll possibly resolve on their own. Well, that's not going to happen. The answer to that is they won't resolve without your input. So the expectation is that these alerts will be resolved in a timely manner, so that your CDIS data can be analyzed. So resolve your alerts the same time that you're putting in your data. Make sure that you've got a date for that, so the 25th of each month that you're resolving the previous month's submission. But I want to stress again that if you want to put your data in and resolve your alerts real time, that's acceptable too. So speaking of alerts, we're just going to look at a couple here. This is a screenshot of the alert screen. So when you log on, this is the first thing that you're going to see. And that's, of course, after you've completed your facility enrollment and your annual survey and you're ready to start entering data. You shouldn't have any alerts the first time that you log on. This will be something that will occur possibly as you progress in your NHSN reporting. The most common reason for alerts is missing or incomplete denominator data, that's your summary data for each month, or that you're missing a reporting plan. This is the actual alert. So this is from the previous screen. And when you do the previous screen, it indicated there was 2 incomplete summaries. So when you click on the hyperlink here, it shows you exactly what's missing for that particular time frame. All alerts have to be resolved before any other reporting can occur. So here's, remember, 2 facts. If lab ID events have already been reported during the month for CDIS, then the report no events box will be disabled. So you don't have to really worry about going in here to click the no reports or no events box if you have already entered events, because that will not be open. But if you didn't have any lab ID events for the month, then you need to go in here and click this box in order for us to be able to pull any data from NHSN. And don't worry, because say you clicked this box or this little checkbox for report no events, and then you find an event or you go back and you have to enter one, that's fine, because NHSN is set up to automatically just unclick that box then. In this example, the nursing home didn't have any events to report, but because they didn't click that box, an alert was triggered. So it goes both ways. So a little more about reporting. This is what you need to do in advance. Let's make sure that you have established a process for determining your resident days, your resident admissions, and your resident admissions on CDIS treatment using the NHSN Denominators for Long-Term Care form, which there is a link to that right here. And it's also in your binder. As you can see, all of this information on this page is in your binder. And I'm really glad binder is all in capital letters. Make sure that you familiarize yourself with the NHSN Lab ID event form and everything that's needed to report a Lab ID event. set up your NHSN monthly reporting plans for your facility, and you will report every month. Even if you have 0 C. diff in your building, no lab ID events, no C. diff lab tests sent out, you still need to report each and every month because you will have that summary data to report. And then, of course, you'd be clicking the No Events box. This is a little checklist for you for reporting, so you need to verify your long-term care locations and that they're mapped correctly in NHSN. If you forget which locations you have that you can report to, you can click on that and review it. But these location mappings should be reviewed at least yearly. So when you're doing your annual survey, you can go in and just make sure nothing's changed in your facility on what type of units there are. Review your monthly reporting plan and make updates if necessary. If this monthly reporting plan doesn't change, just remember that once you've created your monthly reporting plan and you know it's going to stay the same, you can actually copy that forward for 12 months. That way you won't forget, you've got it in there, you don't have to worry about doing it again. Make sure that you're identifying and entering all C. diff lab ID events into NHSN by location, and in previous webinars we've discussed keeping a line list of these. And enter your denominator data each month for surveillance. So NHSN, let's just talk a little bit about lab ID event categorization. NHSN will actually categorize your lab ID events by incident or recurrence. So an incident C. diff CDI lab ID event is any CDI lab ID event from a specimen that is collected greater than 8 weeks after the most recent CDI lab ID event, or of course it would be one where there's no previous positive CDI lab. Recurrent CDI lab ID events are any lab ID event that is entered greater than 2 weeks but less than 2 weeks or less than 8 weeks after the most recent lab ID event reported for an individual resident in your facility. So they want to make sure that this is the first event, or it's greater than 8 weeks, or that it's a recurrent event that is happening less than 8 weeks. So when do you report? You should have seen this algorithm before, but let's just quickly go over this. So you have a positive C. diff test result. If you've had no positive C. diff test results in your facility within the last week or last 2 weeks, you would report this as a CDI lab ID event. If you have had a prior positive within 2 weeks, this would be a duplicate. And this is not something that you would put into NHSN. It would be a duplicate CDI lab ID event and would not be entered into NHSN. This is where it's really important to keep your line list so that you can go down through and be able to see which positive lab test results need to be reported to NHSN as a lab ID event. So then those lab ID events will be further categorized by NHSN as community onset or long-term care facility onset. So community onset would be any positive lab ID or lab test that is collected on day 1, 2, or 3 of admission. So that is a positive lab test that occurred due to a community onset. If you have a positive lab test that's collected after day 4, that is going to be long-term care facility onset. So that will be a facility onset lab ID event for your facility. And then we further categorize those long-term care facility onset lab ID events to be acute care transfer long-term care facility onset. So that would be a lab ID event that was collected in your facility with a transfer from an acute care facility within 4 weeks. So that would have been acute care transfer, long-term care facility onset. It is still a facility onset for your facility, but is further identified as coming from an acute care facility. So now we're going to do a couple of case studies. And as you can see, we've given you the answers right off the bat. This is not to stump anybody. This is a learning experience for all of us. And I'm going to read through and we're going to work through a couple of these. So this case scenario number 1 is talking about how is the date of the first admission to facilities defined. Now remember, we have 2 different dates that we have to put on our CDI Lab ID event form. It's the date of admission and the date of current admission. So this is asking the question about the date of first admission to the facility. How is that defined? That's defined as the date the resident first entered the facility, even if the resident leaves the facility for short periods of time, as long as that's all within 30 days. So what if the resident left the facility for greater than 30 days and then returns? Then the date of first admission should be updated to the date of return to the facility. So if it's greater than 30 days that the patient leaves your facility before they come back, that date of admission will change. If it's less than 30 days, that date of first admission will remain the same. And just in case you're thinking that you've never learned any of this, we're going to go back to, and I see binder is not capitalized in this slide, and I really should have capitalized it. But all of this in more detail with slides and screenshots and tip sheets and all your forms, all of this is in your binder. So please remember to pull that out, and if you have not gotten it, get back to Teresa or Linda, and they can get that binder to you. So let's just go over this one more time. The date the resident first entered the facility, this date remains the same even if the resident leaves the facility, as long as they haven't left for greater than 30 consecutive days. If the resident does leave the facility and is away for greater than 30 consecutive days, that date of first admission is going to change and be updated to the date that that resident returns to the facility. So what is the date of the current admission to the facility? So this second case study here is going to talk about that second date that I talked about, the date of the current admission to the facility. That'll be the most recent date that the resident entered your long-term care facility. So what if the resident leaves the facility for more than 2 calendar days? So that's day 1 will be the day that the resident left the facility, and then if they're gone more than 2 days, the date of the current admission should be updated in that case. If the resident has left your facility for greater than 2 calendar days, you will be updating the date of the current admission to be the date that they return to your facility. So what's the date of the current admission if the resident leaves the facility for less than 2 calendar days, and then they return? So in that case, the resident hasn't left the facility for more than 2 calendar days, so the date of the current admission will not change. It'll remain the same. So the most recent date that the resident enters the facility, this is the resident enters the facility for the first time and hasn't left, then the date of the current admission will be the same as the date of the admission. So let's just say that again. The date of the current admission, the most recent date the resident entered the facility, if the resident enters the facility for the first time and they never leave, then those 2 dates will be the same. But if the resident leaves the facility for greater than 2 calendar days, the day that the resident left the facility, or the date that the resident comes back, will be the current admission date. It gets a little confusing. So let's go on to case scenario number 3. On April 1st of 2015, Mrs. G, a 70-year-old resident in your facility, had several episodes of diarrhea, and the doctor was called. A stool sample was ordered for C. diff testing. The resident does not have a history of C. difficile while in your facility, and she does not have a recent history of being in any other facility. So the next day, on April 2nd, a loose stool sample was collected and sent to the lab, and the result came back positive for C. diff toxin A. So is this a CDI lab ID event? And the answer to this is yes. There's no previous events in the last 14 days. This patient is in your long-term care facility, and they have a positive C. diff lab test. So a C. diff positive lab assay obtained while a resident is receiving care in your long-term care facility, and the resident has no prior C. diff positive lab assay collected in the previous 14 days while in your facility, is the definition of a CDI lab ID event. So what is the CDI event date in this scenario? The patient had diarrhea that started on April 1st. However, the date of the event is the date that the specimen was collected. So that would be April 2nd. Since the resident has been in your facility for more than 3 calendar days and has not been transferred from any acute care facility in the previous 4 weeks, how will NHSN categorize this CDI lab ID event? And they will be categorizing it as long-term care facility onset lab ID event for your facility. So your resident's been there more than 3 days, no previous, and they get a positive C. diff lab. That would be, in this case, long-term care facility onset. So what if the resident in this case had spent time in an acute care hospital the previous week? So how would NHSN categorize this C. diff lab ID event then? And that would be one of those acute care transfer, long-term care facility onset lab ID events, because the patient had been transferred from an acute care facility within the last 8 weeks. And that is right here. So since the resident does not have any prior C. diff lab ID events that have been entered into NHSN, will this CDI lab ID event be categorized as an incident, recurrent, or a duplicate? And of course, this is an incident because there isn't any previous lab ID events. Any C. diff lab ID event from a specimen collected greater than 30 weeks, or if it's the first lab ID event ever entered for the resident, will be an incident event. Oops, sorry. So case scenario number 4. Mr. T, a 95-year-old resident in your long-term care facility has new onset of diarrhea. So a loose stool specimen was collected and is positive for C. diff toxin on April 5th. While you're reviewing his medical record, you see that he has a history of C. diff, and his most recent C. difficile toxin positive lab test was collected in your long-term care facility on March 29th, so 6 days before. So should the stool specimen collected on April 5th be reported to the NHSN application? And if you were keeping your line listing up to date, you would know that that would be no, because the April 5th lab result is considered a duplicate. It's less than 14 days from the previous positive lab. Any C. diff positive lab test from the same resident following a previous C. diff positive lab within the past 2 weeks or 14 days while in the facility is a duplicate lab ID event. So in this same case, what if the stool specimen that was collected on March 29th was actually collected from an outside acute care hospital, so not within your facility, but in the acute care hospital, and there were no other C. difficile lab results collected while receiving care in the long-term care facility. Would the specimen collected from your facility on April 5th still be a duplicate CDI lab ID event for your long-term care facility? And the answer to that is no. The specimen would be reported as a CDI lab ID event for your long-term care facility, since it was not a duplicate for your facility. So this is really important to understand. When reporting lab ID events for a long-term care facility, only specimens collected while the resident is receiving care in the long-term care facility should be considered for lab ID event reporting for your facility. Lab results from outside facilities should not be included in your lab ID event reporting for the long-term care facilities. Of course, that would be one of those acute care transfer long-term care events. So if a resident has a positive C. diff assay and another positive assay 3 weeks later, should the second positive assay be reported as a CDI lab ID event? And I hope everybody who is doing these case studies know that, of course, we would count this one because we're using 14 days or 2 weeks as our duplicate. So if it's 3 weeks, this would be a second positive assay. So case scenario number 6, we're getting to the end here. What monthly denominator data is entered for C. difficile lab ID event reporting for long-term care? So this is the denominator data, the summary data, that you'll be entering every single month. And that will be facility-wide resident days, resident admissions each month, and the number of residents admitted on C. difficile treatment each month. So it's real important to have a process in place where you can collect all of this denominator data. So now it's your turn. The operator can let us know how you all can ask questions. Maybe there's some in chat that we can answer. But Cynthia, can you let our participants know how they can ask questions?
If you have a question, please press star, then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. If you're using a speakerphone, you may need to pick up the handset first before pressing the numbers. And once again, if you have a question, please press star, then 1 on your touch-tone phone. And we are standing by for audio questions.
Oh, I'm sorry. Do you have any questions?
No, I'm sorry. I was just letting you know we're standing by.
Okay, thank you. Thank you, Cynthia. So while we're standing by waiting for anyone who wants to call in with a question, I am going to turn this back over to Teresa. And we do have people that have been manning the chat during this presentation, so I will let them see if there's any questions there. Teresa?
Very good, Deb. Thank you so much. I love that you are so comfortable with all of this coming from more of a hospital background, and I know the rest of us will become comfortable over time. The other thing I love about the reporting, and I wish it could apply to so many conditions that residents have, but the fact that the NHSN does have a classification to recognize that a resident who has come from a hospital in the last 4 weeks to a nursing home, that they subclassify that positive C. diff event, showing that it was related to an acute care transfer. So I think that's going to be extremely valuable information, and that'll be collected over time for the whole nation, for those of us that have worked in nursing homes for so long. So thank you again for reviewing that. And everyone, I can tell you that in addition to Deb Smith, Katie Richards and Sandy Massick have not left the building. They are still here. So please don't be shy. Please go ahead and ask any questions. I'm not seeing any yet. Personally in the chat, I did see that Sandy Massick stepped up and said that she would be very pleased to create a cheat sheet for everyone that has the definitions that Deb went over today so that we can get that all in one small, nice, neat document as an easy reference. So thank you for that, Sandy. Do we have any questions by any chance?
We do have a question on the phone from Melanie Glover with Kempsville Health. You may begin.
Hi. I did have a question about the SAMS card. We were going through a lot of transition here at this facility, and our director of nursing did apply for the SAMS card, got the notary, and did get that SAMS Club card in. I'm saying SAMS Club, that SAMS card in. And now, he is no longer here with us. So is that something I need to get my own SAMS card for? He did leave it here with us here at the facility. Or is that something that I have to do the whole thing over again and get one for myself?
Sandy,
This is Sandy.
Yeah,
this is Sandy.
Yes, you are going to need to get your own grid card. That grid card that he left with you all is his personal grid card assigned to him, and he should have taken that with him. Melanie, I'll look up your facility, and I'll give you a call after the webinar, and we can talk.
Okay.
It'll probably be after 4 o'clock.
Oh, okay. All right.
any other questions?
We have no further questions at this time.
Anybody else? Don't hold back. I can Sandy gets questions almost every day, and a lot of the frequently asked questions that you saw on the side came from questions that she gets. So feel free to ask them now, but also continue to reach out to Sandy because she really, as you just heard here, I mean, she will investigate. She will call you back if necessary. She will point you in the right direction. We are truly here to help you and want to help you go the distance. So don't let anything, hold you up in this process. And it is a convoluted process. So don't feel funny reading something 3 times and saying, I don't know what the NHSN is trying to tell me. Reach out to us because we do have experts here who can either tell you what they think or we can contact the NHSN directly to get it restated for you. Any other
Teresa,
questions?
this is Sandy. I just wanted to point out that there is a lot of transition in the nursing home arena, and as soon as a facility can get up and running and completely enrolled, then you can add multiple users so that you don't run into this situation where you're at the point where you're going to want to start reporting and you realize someone's left and they took their grid card and nobody else has one. And so it's really important to get through that registration phase and that enrollment phase so that then you can get those other users added.
Yeah, this is Deb. That was a question that I had for the previous caller. Did he actually add anybody as a user so that they could start the process? Because as Sandy just mentioned, that's once you do get up and going, having more than one user there would kind of help that situation.
Deb, I don't believe so in this facility.
Okay. So they have to start from scratch then with that facility.
Yeah, we've got a couple of facilities in that situation where they're going to have to start from scratch. But we can move it along.
But we're here. Yep, that's what we're here for.
Any other questions? All right, well, we're nearing the end of our time. You can see on the screen that's our contact information. Feel free to call us, email us. Email is usually the easiest thing because then we can try to research the answer to your question and get right back to you. And one more time. Any other questions? No? All right. Well, we want to thank you for coming today, listening, and participating. And again, we will be working very closely with you through the entire NHSN enrollment and reporting process. Thank you, everyone, and have a very happy Thanksgiving.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.